There we go. All right. Good morning, everyone. Thank you very much for joining us. Today we have a special guest with us, a dear friend of mine. She's actually come on before, so you may have seen her or recognized her. We have Dr. Fareen Koorjee returning today. She is a naturopathic doctor, and Dr. Fareen engages in integrative and holistic approach to medicine by drawing on her 4 years of medical school training along with 2 years of studies in traditional Chinese medicine and Ayurveda. In her approach to care for her patients, Dr. Fareen uses the latest, most advanced diagnostic tools, laboratory testing, and imaging combined with a thorough health history to understand each patient as an individual, to uncover the underlying cause of their illness and create an individualized treatment plan. She draws on modalities of nutrition, Eastern and Western botanicals and mind-body practices, naturopathic needling, constitutional cupping, IV therapies, and when necessary, pharmaceutical intervention. And just as a disclaimer, just keep in mind that everything that she does say, you do need to check with your doctor, as she's not your doctor. So do check with your doctor for further advice. I'm Fatima.
I'm Fred.
I'm John.
Hi, I'm Cyrene.
Excellent. Let's bring in Dr. Fareen Koorjee in. Hello, Dr. Fareen.
Hello.
Hi, Fareen.
How are you?
Good. I'm doing really good. I'm excited to be here.
Excellent. We can't wait to have you again. It's a pleasure having you again. So tell us a little bit about yourself and what you do and why you do what you do.
Yeah. So I'm a naturopathic doctor. And when I say that, people often ask, what exactly is a naturopathic doctor? So I sort of combine both conventional Western medicine with more Eastern and natural approaches to medicine. And so I have 4 years of conventional medicine schooling, and I have 2 years of medical nutrition, 2 years of botanical medicine, 2 years of homeopathic medicine, 2 years of traditional Chinese medicine, and 2 years of Ayurveda on top of the conventional medicine. So I try and use both both approaches to care with my patients. I'll use the traditional Chinese medicine and the Ayurveda to really understand a patient's constitution and understand their individual metabolic imbalances. And then I'll use sort of the more Western approach to diagnose and to really understand if there's any underlying issues that need to be addressed. So it's a nice sort of combination between the two. And for me, the most important things in my practice really are understanding the underlying root cause of what's going on with my patients. I'm sure you've all had some experience with Western conventional medicine, and you have a symptom and you go and you see that your doctor for a symptom, and then the doctor gives you a pharmaceutical for that symptom, and then you feel better, which is great. And then, years later, you go back for another symptom and the doctor gives you a pharmaceutical for that symptom. And symptom relief is really important because you want to feel better. But the reason why my approach is different than what a conventional medical doctor does is because what I realized is as soon as you take off the pharmaceutical, the symptoms come back again. So you're not really doing anything to actually to heal the patient. And so I wanted to find a type of medicine that really does heal what's going on with the patient. And when we look at and address the underlying root cause of what's going on, that's when we're really able to heal the patient. And the other thing that's a really big part of actually healing the patient's imbalances is to use the body's innate and powerful ability to heal itself. So you probably have all at some point cut yourself. And as long as we give that cut the right environment, we keep it dry, we keep it clean, the body can really do its job to heal the cut. And it's the same thing with any other imbalance in the body. All we have to do is give the body the right environment, and then the body can begin to heal itself. And what I found is that when we treat the underlying root cause and we promote the body's innate ability to heal itself, you aren't tied to pharmaceuticals or to supplements long term. We use supplements and nutrition and lifestyle modification to give the body what it needs so that it is able to do its job in healing the body. So those are sort of the big ways that I approach care. And for me, when patients are having symptoms, that really is, to me, the body's way of communicating with us when something is out of balance. And I think in our culture, in this North American culture, it's so often we're told to push through the pain and to ignore what's going on so that we're able to be productive in life. And for me, there's a problem with that because I really do think it is the body's way of communicating with us. And so I hope that in this short time that I spend with you and your viewers, that this will sort of be using, I know we're going to talk about the stones that the body produces. We can use this as a way to show people how important it is to connect with our own bodies, because I think we've really lost that ability. And hopefully by the end of this half hour, 45 minutes, I'll be able to show you ways to really connect more with your body so that you're able to listen to these signs and then, try and figure out what the body is trying to say to you. And sometimes, doing that on your own isn't always possible. So then you have to talk to a naturopathic doctor or another type of practitioner that can help you with that.
Excellent. That's very extensive and it's great detail to, actually put out there so that our viewers sort of understand. So now when you say there's stones, there's 3 different types of stones. Can you sort of go over the stones that affect our health?
Yes. Again, stones are caused by imbalances in the body. And they're really the way the body is trying to bring itself back into balance. Because our bodies, the job of our bodies really is to come back into homeostasis or balance. And the body is constantly trying to do that. And as human beings going through our busy lives in this modern world, we are constantly throwing our bodies off balance. And so, with poor diet or too much sugar or too much alcohol or not getting enough sleep or not getting enough movement in our lives, it throws our bodies off balance. And when we're young, our bodies are able to get back into balance a lot more easily. But as we throw the body off balance more and more, and as we sort of go through the aging process, it becomes harder and harder for the body to come back into balance. And what we start to see is that's when we start to see symptoms, because the body is trying to tell us that we need to do something to help it to get back into balance. And so that's exactly what the different types of stones that the body's producing is a way that the body's communicating with us that something's wrong. And that there's some imbalance in the body. And usually with stones, we need 2 circumstances to come together. The first is some sort of a susceptibility. The body has to be susceptible to making stones. And then the second thing is some sort of a triggering event or triggering events that create the stones. And so usually with most stones and in most people, the susceptibility comes from poor diet. So poor choices in our diet that makes us more susceptible to the stones. I'll start by talking about gallstones so that we can make it a little bit more tangible. So gallstones are created in the gallbladder, and the gallbladder is an organ that sits right underneath your breastbone and a little bit to the right-hand side. It's connected to the liver, And the liver makes something called bile, and bile is stored in the gallbladder. And bile is kind of a digestive juice that helps the body to digest things. And it's made up of lots of different things, including cholesterol. And when we have, when our body produces, or when we give it, the body too much cholesterol, and our body is prone to making gallstones, then that bile becomes a lot more thick, and it can be more prone to producing gallstones. And so if you are prone to producing gallstones, or you do have gallstones, you want to make sure that your diet is low in cholesterol. Now, in sort of the Western perspective, we're always looking to make sure that there's not too much cholesterol in the diet, because we don't want that cholesterol to deposit into our blood vessel lining and cause atherosclerosis. But as a naturopathic doctor, I'm also looking to make sure that our cholesterol isn't too low, because cholesterol is the building block for all of our hormones. Estrogen, progesterone, testosterone, the backbone of all of these hormones is cholesterol. And so I don't want anyone to think that they need to take out cholesterol from their diet completely, because cholesterol is really, really important as a building block for these hormones. And so if you don't have enough good quality cholesterol, you're not going to make good quality hormones. So you want to make sure, but you want.
Sorry, what are good quality cholesterol?
So there's two things for good quality cholesterol. One is getting good quality fats in your diet. So olive oil is a really good fat. Organic coconut oil, ghee is really good. Grape oil. What's that?
Avocado.
Avocado oil, yes. The nuts and seeds, different types of fish oils are all really good oils or fats for the body. You want to stay away from anything that's genetically modified, like canola oil, sunflower oil, safflower oil. Those, as soon as you heat those, they turn to bad quality fats. And then the other part of cholesterol is the inflammatory process. So if there's a lot of inflammation in the body, it can convert good quality fats into bad quality fats that can turn into bad cholesterol. And the things that cause inflammation in the body are stress, poor sleep hygiene, alcohol, processed sugars, food sensitivities, and toxins. Any sort of a toxin burden. So those are the things that sort of will determine our cholesterol levels. And so if you're prone to making gallbladder stones, you want to avoid things like pork and eggs and fried foods, because those will contribute to the bile becoming really sludgy in the gallbladder. The other thing that can contribute to this is too much estrogen. There's something called estrogen dominance, when your estrogen level compared to your progesterone is too high. And there's different times in our lives and different things that can contribute to this. So when young girls first get their period and they're going through adolescence, oftentimes their estrogen will be, compared to their progesterone, will become really high, and they'll go into a state called estrogen dominance. And often we'll see mood swings, we'll see breast tenderness, women might develop fibroids or endometriosis. These are all signs of estrogen dominance. The other time that we see estrogen dominance, a lot of times as we go into perimenopause, a lot of people think of estrogen falling, but really the first thing that falls in perimenopause is progesterone. And when progesterone falls, then the estrogen to progesterone ratio becomes imbalanced. And you have too much estrogen and you get estrogen dominance. So that's another time where we might be prone to gallstones. When we go into menopause, and there's some women that bioidentical estrogens, And then if they don't balance it with progesterone, it can cause lots of different issues. And make yourself more prone to gallstones. And then the last thing that can increase your estrogen balance is something called xenoestrogens. These come from plastics. So if you're using plastic water bottles or plastic containers to store food in, I always recommend to my patients that they use either a glass or stainless steel water bottle, or when they're storing foods, to store it in glass or stainless steel. Because what happens is plastics, even BPA-free plastics, contain something called xenoestrogens. These are synthetic estrogens, and they leach out into our food and our water, and then we consume that. And then we have this unbalanced and unhealthy estrogen in our body that then creates problems and can make us more susceptible to gallstones.
I'm kind of wondering, I hear men get like kidney stones more than women, right? Is that true?
So there's certain types of, when we talk about kidney stones, there's certain type of kidney stones that men are more prone to getting. There's a type of kidney stone that's made from foods that are high in purines. They're called uric acid kidney stones. And so if you're prone to getting gout, or you're prone to, or you're eating a lot of foods that are high in purines, and purine-rich foods are alcohols, animal meats, gamey meats, organ meats, fried foods, shellfish and fish. Those are the main sources of purines that can make you more prone to a type of kidney stones called uric acid stones. And men are more prone to getting that type of stone than women are. And gallstones, I think women tend to be more prone to it, only because their estrogen levels tend to be higher. And so they say female, fat, fair, and 40. Those are the predisposing conditions for gallbladder stones. So, because of the estrogen component, females tend to be more prone to getting gallstones than men. If you tend to be overweight, you tend to store more estrogen in the body, and that makes you more prone. And you may have a higher fat diet and a higher cholesterol diet. 40 is when, as I mentioned, your progesterone often starts to drop. And so then you get this estrogen dominance because progesterone is dropping, and fair, white Caucasian women tend to get it more than ethnic women.
So as a tool, how do you measure that? Like, how do you, if I came to you and told you all these symptoms, what would would be my protocol?
In terms of treatment or diagnosis?
Of finding out the symptoms.
Yes.
Sometimes women or people in general will say, oh, I have all these symptoms, but it may or may not contribute towards what's actually happening, right?
Exactly. That is so true. And that's where the Western conventional medical diagnosis comes into play for me. And I use that to sort of differentially diagnose what's going on and sort of try and figure out, okay, is it this, A, B, C, D, and then rule things out. And so first of all, we look at symptoms. And generally when people have gallstones, often they're really small and they just pass and people don't even realize. But if they're coming to see me and they have symptoms, oftentimes they're in a lot of discomfort. So they'll have, upper abdominal pain. They'll get, very commonly, we'll see it as pain in sort of the scapular region in the upper back. So it's, pain is the biggest symptom. And usually at that point, we'll do things to help treat it. But if it was a small, because they're in so much pain, and the only thing they want to do is get out of pain, which I totally understand, because it's like a 10 out of 10 pain for a lot of people. But if they're not in so much pain and I'm not sure what's going on, then, we'll do some blood testing, and we'll often do some imaging. So you can do some x-rays to have a look and see if they actually do have gallstones.
So Dr. Fareen, in terms of so we know that there's three types of stones. We've
Mhm.
covered the gallbladder stones. What about kidney stones? What causes kidney stones and who's prone to get them?
Yes. Okay. So with kidney stones, there's a few different types of kidney stones. The most common type of kidney stone is a calcium phosphate and oxalate stones. Then there's also a strubite stone, and then the uric acid stone that we've already talked about. So the most common stone is the calcium phosphate and oxalate stone. Those people that are really prone to getting these are ones who have a dietary component that's affecting what's going on. So if they're predisposed to getting kidney stones and their diet is high in calcium, the excess calcium that the body needs to excrete through the kidneys can form crystals, especially if we're dehydrated as well. It can form crystals that can form kidney stones and cause issues. Foods that are high in calcium, many people know, are dairy-rich foods, soy. And then what people often don't know that I'm always surprised at is if, a lot of women who tend towards osteoporosis, or even men who tend toward osteoporosis, they're taking a calcium supplement. And calcium, if you're taking it on its own, does not get absorbed well by the body. And so you can end up with bony outgrowths in your joints. You can end up with calcium deposits in atherosclerotic plaques. And you can also end up with kidney stones because the body's not able to absorb the calcium on its own. So if you're taking a calcium supplement, you want to make sure that you're taking it with vitamin D, with magnesium, with boron, strontium, and manganese. If you're prone to kidney stones, there's a supplement called Shilajit, which is a mineral pitch from the Himalayan mountains that is really, really good. I usually have a lot of my patients on Shilajit, but diet plays a really, really big role. Foods that are rich in calcium and would be really important. The other thing that's big is phosphate plays a big role. So anything that's carbonated, we were talking about this earlier. So carbonated beverages contain phosphates. So pop and sodas, you'd want to definitely avoid any sort of pop. You'd want to avoid any carbonated waters like Perrier. And you'd want to avoid things that often people think are really healthy, like La Croix or Zevia. I don't know if you guys have those in Canada, but those are really popular here in the US. And people don't realize that actually the phosphates are pulling out calcium from our bone stores and contributing to two things, contributing to our risk of osteoporosis, which is a big issue for women as we go through perimenopause, menopause, and postmenopause. And it also contributes to kidney stone formation. So it's really important for that. And then the third thing that can cause this type of stones is oxalates. And foods that are high in oxalates that you'd want to avoid are alcohol, caffeine, including cacao, spinach, nuts, and fried foods. Would be big things to kind of avoid.
And what about salt? How does salt play a part in kidney stones?
Yeah, so salt can cause you to your body to get really dehydrated. And when you get dehydrated, it contributes to the crystal formation. And so I recommend that everyone, whether you're prone to stones or not, that you drink half your body weight in ounces of water. And that would be still water, not the carbonated water. So for example, I'm 120 pounds. So I would drink at least 60 ounces of water a day. And if you're prone to making stones, you want to drink even more than that.
So if someone has the stones, and what is something that they can do to pass that, or not have to worry about it again?
Yeah, so prevention is huge. And so avoiding these foods would be key because that decreases your susceptibility. So avoiding foods that would make the crystals, drinking enough water is really important. And then it also depends on the type of stones, because there's a type of stone that's really common in women called Strubite Stones. And for these ones are caused more, again, by an estrogen imbalance, but this time because estrogen is dropped rather than estrogen being too high. So women in menopause or going into menopause are more prone to this one. So you'd want to make sure that you have a really good hormone balance to prevent this type of stone. And also women who are prone to infections, especially bacterial infections with a type of bacteria called Proteus, they'll be more prone to this type of stone. So really making sure that your immune system is really healthy is also really important. So making sure that your vitamin D is at a really good level, making sure that you're getting enough vitamin C. I usually recommend 1 to 3 grams of vitamin C, but you have to be careful because it can give you some diarrhea. And the way that you tell the dose that's a really good dose for you is to do it to what I call bowel tolerance. So you take as much vitamin C as you can until you start to get some diarrhea, and then you just kind of back off on it a little bit. And that tells you the dose that's the correct dose for you in terms of vitamin C. And then, 70 to 80% of our immune cells are located in our gastrointestinal system. So really looking after the gastrointestinal health is really important for immune health, for sure.
And go ahead, John.
I was wondering, like, what if because most of the time people are not thinking of prevention, right, until they get it, Dr. Fareen. And so what happens is, you wake up and you have it. I have friends that woke up and they have it. They can barely move. Like it's 11 out of 10 on the pain scale.
Right.
What is something that they can do maybe that can kind of alleviate some of the painful symptoms until they get to, or until it passes, right? But most of the time they're going to go to the doctor or something. But
or to the ER because the pain is so bad.
Is there something other than, is there something that you can recommend, like right away when they wake up and they just can't get out of bed?
Absolutely, yeah. So it depends on the size of the stone. The bigger the stone, the more damage it's going to cause and the more pain it's going to cause. With really large stones, you really need to go to the ER and they'll break up the stone. But for stones that are, where the pain is bearable, even though it's intense, the best thing at that point is to do things that are going to increase your body's circulation to help the stone pass. So you want to increase blood circulation. So there's something called hydrotherapy that's really good for this. So it's using hot and cold, alternating hot and cold. So what you do, depending on where the stone is, if it's a gallbladder stone, you're going to put it on your upper abdomen. If it's a kidney stone, your kidneys are in your lower back, located in your lower back. So you're going to put it on your lower back. So what you're going to do is you're going to take a hot pack and put it on the area for 5 minutes. And then you're going to take an ice pack, and you're going to put it on for 1 minute. And then you're going to do the same 3 cycles of that. So hot pack, and then another cold pack for a minute, and then hot pack for 5 minutes, and a cold pack for 1 minute. And what that does is it causes this vasodilation. The hot pack causes a vasodilation, and then the cold pack causes like a constriction. And that vasodilation and constriction really increases the blood flow through the area. And that helps the stone to pass. The other thing that can be really helpful with pain and with helping the stone to pass is acupuncture. And some people will do even a castor oil pack even before they do the hydrotherapy, where you take organic castor oil, and you can get that at any grocery store. I think Whole Foods might carry it. And it's a really thick oil, and you rub it onto the area. And castor oil is highly anti-inflammatory, so it's going to decrease inflammation, which will help to decrease pain. And it also helps with circulation. So you do that before you put the hot pack on, and it'll really help to decrease pain and increase the circulation. The other thing that you really want to do is move the lymph, because your blood is what's going to bring oxygen and nutrients to the area, but the lymph is what's going to remove toxins from the area. And so dry skin, this isn't something you do in the moment, but if you know that you're prone to getting these types of stones, doing dry skin brushing. So your thoracic duct is located sort of kind of near your heart. And so you know, before you go in the shower, you would take a dry skin brush and brush your skin really gently towards the heart, your legs, your arms, and your torso, and that moves the lymph and it moves things through your system. You could also do like a lymph massage, and that would help as well.
So I've actually got a question in terms of the kidney stones. Shoot, I forgot it.
Oh, I'll just add to what I was saying to John's question, just while you're thinking about it.
Yes.
The other thing is you want to do some things for the pain, because absolutely the pain can be really severe. And so usually what I will do is I will do some sort of a herbal, depending on the patient's constitution, I'll put together an herbal tincture for them to help with the pain. So anything that's anti-inflammatory, so decreasing inflammation, an anodyne will really help with the pain as well. An antispasmodic, so if the muscles are kind of spasming in the area, then I'll do what's called an antispasmodic herb as well. And I'll sort of mix them all together depending on what's going on with the patient and what's going on with their constitution. Because there's certain herbs, you know, they all have energetic qualities to them. Certain herbs are very heating. And so if someone already is sort of going through menopause and they have a lot of hot flashes and they're very dry and they're really have a lot of heat in their body, then you don't want to choose herbs that are heating. You choose more cooling herbs for them and more sort of moisturizing herbs. So just depending on their constitution, I would.
I remember the question. So now,
Okay.
in terms of anti-inflammatory, would you suggest or recommend grape seed extract?
So grapeseed extract is a really nice antimicrobial. It has more of an antimicrobial property than anti-inflammatory. It doesn't have a strong anti-inflammatory property. So it could be good for like a struvite kidney stone where there's a bacterial component to it. The really nice thing about herbs is that they don't just have one property. So something like grapeseed extract has a really strong antimicrobial component, but it also has a little bit also of an anti-inflammatory component. So if you had a struvite stone, that would be a really good herb to choose because it's going to kill the bacteria that's causing you to be more prone to the kidney stones. And it's also going to have a little bit of an anti-inflammatory effect, but for this kind of pain, you need something that's really strong.
And what about turmeric? Would that help with?
Yeah, turmeric can be really nice. It is definitely an anti-inflammatory herb, but it's one that you sort of use over the long run. It's not going to be like a pharmaceutical where you take it and all of a sudden you're going to feel better. It's one where if you know that you have kidney stones or gallstones, then you would take it as a way to prevent and to decrease inflammation, because the inflammatory component is big in stones as well. So doing anything that's anti-inflammatory, so managing stress, getting good quality sleep, decreasing processed sugars, decreasing toxic burden, all of those things will contribute to decreasing inflammation.
Perfect. So we've got very little time left. So do you want to quickly go over the salivary stone that we have?
Yeah. Okay. Yeah. So the third type of stones that we get are called salivary gland stones. And that happens when there's a crystal forms. It's a calcium crystal. It forms between the salivary gland and into the salivary gland duct. And it blocks the flow of saliva. And saliva is really important because it helps to lubricate the mouth. It helps to lubricate food so that we can digest it. It contains a digestive enzyme in it called amylase that helps to digest carbohydrates. So it begins the digestive process. It keeps your oral microbiome really healthy and the oral pH really healthy. So it's really, really important. It aids in taste and digestion. And again, strong diet component to salivary stones, because they're made of calcium. You want to, if you're prone to these types of stones, you want to really be careful of getting too much calcium in your diet. make sure that you're getting enough water. There's certain medications that make you more prone to these types of stones. So antihistamines, antidepressants, and antihypertensives, so high blood pressure medications, can make you more prone to these types of stones. And then women and men who get infections in the salivary gland or in the duct itself, they can also, if they get chronic infections, that can make them more prone to salivary stones. So keeping the immune system really strong is also really important.
I've had the salivary stones, and let me tell you, they're not fun. It's so painful.
Yeah.
It was like literally like a speck, like a little dot of a stone that was in my salivary gland here. It like swell up out to here like a golf ball.
I know, it's amazing how something so small can do so much damage. The other thing that can be helpful is just, again, making sure that the circulation is going. And, for a lot of people, taking sucking on something astringent and kind of bitter or sour, like a lemon, can be really helpful, or like a hard lemon candy can help to get that circulation going in the mouth to help the stone move through.
Yeah, so my doctor had said the candy, and I was like, I can't even chew because it hurts so much.
Oh,
So
God.
I did the lemon juice for about a week and a half.
Yeah.
And then finally it actually dissolved and it came out. It was like very gritty. Like when it was coming out, it was like sand in your mouth.
That's the calcium that makes the stone. So I know it's not fun.
Oh no, it wasn't fun. And definitely I was not able to drink water, and that's like one of my favorite drinks, or my only drink that I have.
Yes.
I was very dehydrated at the time. It looks like John has a question.
No, I was just gonna say, just like I was gonna repeat, like something so tiny can cause like people to just shrivel up and just go in the fetal position on the ground, because my brother-in-law went through it, and he had it, I think, twice maybe, because if you're prone to it, you're prone to it again, unless you make these these adjustments prior to getting them, because most of the time people get them and then they want the results, but it's what you're doing up to the point where you're either going to get it or not. And after getting them, I don't think anybody that got them wants to go through it again. You want to make these changes.
Yes, absolutely. And I always say that prevention really is it's such a big part of my practice, because if we can prevent you from having, getting stones or having any sort of imbalance in the body, it's so much better than once you're in a disease state, which I think, this is where this type of medicine can be really can shine. Because with conventional medicine, conventional medical doctors, they're really good at knowing what to do once you're in a disease state. And with this type of medicine, we're really working to prevent you from getting there. And so my hope is that one day, conventional Western medicine and this sort of more naturopathic medicine can work hand in hand, because I really do think that would be in the best interest of the patients.
In my previous life, I used to have, this is like 10 years ago or more, I used to have kidney stones every Christmas time. And it used to happen from I am okay to I am in extreme pain. It was instant. But the thing that relieved the pain, because it was so painful, is it always happened at work. And my senior sous chef was used to it after a few years. He goes, "Oh, Fred, it was going to Christmas. I'm ready." Just put his elbow in my lower back and just press and gently go like this. And the pain would almost be gone. But as soon as he stopped, it would come back right away.
Oh, gosh.
Pressure helps.
A lot of times, if there's a lot of muscle, the muscles will contract, the muscles in your lower back will contract around that area to help kind of protect it. And if there's a lot of muscle contraction, even the intense muscle contractions can cause pain. And so doing something like a massage or putting some pressure can be really helpful. And also, heat can be really helpful as well to release the muscles.
Yeah, I've learned a lot today. I wish I knew before I had the kidney stones. But as you said earlier, prevention is key, because now with my healthier lifestyle, I've never had kidney stones again at all.
Yes, and it's very possible, you know, when you're doing the things that keep your body in balance and not doing the things that make you susceptible to it. A lot of times it's diet, not drinking enough water. It's making sure your hormones are really balanced and your immune system is really strong. And it's not something that you have to have. It's your body's way of telling you that something is out of balance.
That's right.
Yeah.
Well, this was amazing. It's been so informative. I know we can probably talk for hours and hours and hours.
Good.
You could answer all these questions for us, but unfortunately, we are out of time. So thank you so much, Dr. Fareen, for joining us. And
it was my pleasure.
Back March 8th for gut health. We'll be talking about gut health with her. So again, if you have any questions, please put those in our comments or message us, and we can get these questions out to Dr. Fareen. So on Tuesday, we are going to be tomorrow. We are going to be starting at 10 o'clock instead of at 11 o'clock, as the 4 of us have a course that we're on. We won't be live for Thursday, so there will be no viewing on Thursday, as we are on a course. Then next Tuesday, we will be back to our regular scheduled time. Thank you very much for joining in, and have a wonderful day. Bye for now.
Thanks for
guys.
Thank you, Dr. Fareen.
You're very welcome. Bye.
Bye.
Bye.